am Femi OK, and you are watching The Stream. Today we're looking at Iran and how it is handling its coronavirus crisis. Now, according to many sources, Iran is now open for business. Sort of open for business, low risk business. We would love you to join in this conversation. You can do that on Twitter at ajstream and also in the YouTube chat. Your comments will be fed into the show. I'll be checking them out and putting them to the guests. So let's meet the guests. Hello, Abbas. Welcome to The Stream. Tell us who you are.
Hello from Tehran. My name is Abbas Aslani. I'm a journalist and senior research fellow at the Center for Middle East Strategic Studies. I'm in the capital city, Tehran.
Good to have you. Welcome to The Stream. Hello, Nagar. Welcome back to The Stream.
Thanks for having me. I'm Negar Mortazavi, an Iranian-American journalist based in Washington, D.C.
Hello, Vera. Welcome to The Stream. Tell us who you are.
Hello. From Oxford, I'm Vera Ameli. I'm a doctoral student currently at Oxford University. I focus on public health in Iran, so I spend half of my time in Tehran and half of my time in Oxford.
Good to have you, guests. Let's start the conversation with Dr. Niloufar Ibrahimi. She told The Stream a little bit earlier how difficult it was for medical staff initially when they were trying to handle the coronavirus outbreak in Iran, and she explains how difficult that was.
At the beginning, the situation wasn't good at all because all of a sudden the hospital turned into the center of an infectious disease, and we had to close some departments such as our dialysis department in order to protect the immune compromised patients. Also, the number of admitted patients was overwhelming. We didn't have enough beds for some. Our colleagues got infected, and unfortunately, the virus took away some of them from us.
But Vera, now there are businesses which are beginning to open, but people are still dying. So from a public health perspective, what does that actually mean? What is the risk that Iranians are taking?
So, of course, if you want to answer the question from an absolute public health perspective, it would be better to have lockdowns and not have anyone leave their houses. But of course, when we're thinking about deaths caused by coronavirus, it's also important to think about deaths caused by malnutrition, hunger, and poverty. And so Iran, as opposed to many other nations that are facing the coronavirus crisis, is economically pressured under U.S. sanctions. And so the reason for opening up is primarily to make sure that people in the disadvantaged classes are not going to struggle more severely. So the issue is not in what you see in many Western countries where the concern is about economic growth. It's more about actual deaths that would be caused by this crisis. And from an epidemiological perspective, right now Iran has had lower death rates, and the recovery deaths are higher. So it's in a similar position as you can say to Germany. So even though it's risky, it's also possible to open up.
Abbas, if you were going to walk me around your neighborhood in Tehran, what would I actually see? What would people be doing out and about?
Well, after some quite weeks of outbreak of the novel coronavirus in the country, we are seeing that the country is reopening gradually. And from social distancing, the government said that they are shifting towards smart social distancing. Means you will be able to go out. They have tried to lift the limitations between the intercity or inter-province transportation. But yet we have some distance from that normal condition in the market or on the streets. You can see that some shops have reopened, but you cannot see those many customers that were present in those shops some time ago and before the COVID-19. And the situation in the country was difficult initially because there have been two targets. On the one side, the government wants to avoid more death tolls. On the other side, they want also to save economy. Iran's economy was not in good condition even before COVID-19. So we have two targets. One side is to avoid more infections and death tolls on the one side, but on the other side is to avoid a bad economic condition. And these two targets, interestingly, they contradict each other. And this has somehow been compounded by the sanctions by the United States, because in order to combat the virus, you need medical resources as well as financial resources. So now that Iran has tried to use those medical resources, it also needs financial resources. During the sanctions time, I think it has been a bit difficult. We have been seeing that Iran, comparing to other countries, have somehow have been reopening gradually sooner than the other countries maybe. And if it wasn't due to the sanctions, we might have a bit more of time to reopen gradually.
Abbas, I want to bring in a personal story, and thank you, Nagar, for tweeting this out. You retweeted a story about an Iranian butcher who's gone bankrupt, and he recorded a video for the president. He says, "I don't have food to feed my family after 20 years of working. I'm not Israeli, an American spy, or a spy against the revolution. I'm Iranian. Do something for us." And then he pans around, and you can see just these empty shelves. I don't understand every word he's saying, but I can hear the heartbreak. Why did you share that, Nagar?
Well, as it's been said, it's the story of many different demographics in Iran. The economic crisis is a very serious problem right now, and it goes face to face with this outbreak. It's not only the problem in Iran, as we can see, it's basically a universal problem right now, but there's different challenges in different countries, and this lack of economic resources is one of the somewhat unique challenges that Iran is dealing with. There's up to a 50% of budget deficit within the Iranian government this year, one of its highest, if not the highest, in its history, as experts are saying. And to fill that gap under these very crippling sanctions from the U.S., the government is facing a serious challenge. Like Vera was saying, from a public health perspective, they have to continue the lockdowns. Even officials in the health ministry are basically recommending that the social distancing and lockdown continue. But from an economic perspective, you need resources to feed the population when you tell them to not work, when you tell them to stay home. And it just seems like the government doesn't have enough of those resources. That's why they even asked for an emergency loan from the International Monetary Fund, a UN financial body. For the first time since the 1960s, they've asked for an emergency fund of $5 billion. And that just shows of the lack of economic resources that the government is dealing with.
So, guess this is a real gamble. You're
point?
gambling the economy. Abbas, 1 second. I'm just going to go to YouTube. You're gambling the economy with people's lives. So, Hades Will says here on YouTube, hi, Hades Wills, thank you so much for being part of the show. Will the public still take precautions if the economy opens? That's a very practical question. Who wants to take that one?
Add on that. Yeah. I can add on that because as I have been researching for my article to write about this, and I've been in touch almost constantly with everyone in Iran, the thing that has shocked me most is that the precautions that are taken by the Iranian public are much more strict and serious than what I see in the UK and what I hear from my friends from around the world, really. And that has been quite surprising to me, and it's something that I think it has definitely contributed to the lower and flatter curve that we see in Iran, despite the fact that there weren't any sort of forced military lockdowns in Iran. But because you see right now on the streets of Iran, 80% of people are wearing masks. Many people are wearing gloves. Many people try to disinfect things, whereas in the UK, where the flat is much steeper and we're at the peak right now, if you go onto the streets right now, maybe 1 out of every 100 people is wearing a mask and no one is wearing gloves. So in that sense, I think that even though from a global health perspective, we oftentimes have this perspective that, countries in the global south don't have better hygiene practices. But what we're really seeing is that in the developing world, in many countries, people are actually taking very serious public health precautions.
I want to push us on to talk about the healthcare professionals who are working in Iran. Marjan Yazdi is a documentary photographer, and she's been taking pictures from one particular hospital that is dealing with COVID-19 patients. You can see nurses there in some of her pictures dealing with patients. They have some form of equipment on, but she's been following this to see what is going on.
I have been documenting the outbreak of coronavirus in one of the hospitals in Yazd. There has been problems like shortage of personal protective equipment in the hospitals, which is mainly due to the US sanctions. But at the same time, there has been enormous amount of people's help and big business owners' donations to the hospitals, which has been a great help to the healthcare professionals.
And so Marjan is saying that the lack of protective equipment for the doctors isn't because they haven't been ready, they haven't been prepared, it's to do with sanctions. Abbas, do you want to pick up on that? Because it's not quite so simple as medical humanitarian aid can get through to Iran. It hasn't been. Why?
Well, on the other side, we have been seeing that American officials, they have been talking about sending some aid to Iran in order to help the country to combat the virus. But on the other side, we have been saying that the American government in action, stopping and blocking those aids to be reached to Iran. There have been some pressure groups in the United States intimidating some countries and companies in order not to work with Iran. And recently, Iranian health officials said that the United States Treasury, they blocked a sale inquiry of coronavirus testing kits by South Korea to sell to Iran. And Iran wanted to pay for that. It was not just an aid. And this is something in practice, this is happening. And those personal protective equipments cannot reach to Iran. But initially, this was somehow problematic in the country in terms of finding some masks or in disinfectants or some other things. It was something visible in the country. But these days, I went to a shop a couple of days ago. I saw even in supermarket, we could find some masks, disinfectants, and it was available, and the prices are better and logical this time. But on the other hand, those, let's say, sanctions, they have had impacts on two aspects. That is, as you said, on the PPE perspective
Personal
and
protective
commodities
equipment.
of this kind. Yes, and on the other side, it has been related to those, let's say, the economic resources the country needs to fight against the virus, because Iran has demanded for a loan from International Monetary Fund, and the
Yeah, you
Americans are
mentioned that a little.
blocking that.
You mentioned that a little bit earlier. Let me just go back, dip into YouTube, and give this one to you, Nagar. Marija says, "What can Americans do to hold their government to account and try to end sanctions?" You're sitting there in Washington D.C. right now. What can Americans do?
Well, just to add to what Abbas is saying, and in a way answering the question, U.S. officials continuously claim that food and medicine are not sanctioned, and that's true. That's true that medicine is exempt from U.S. sanctions, but there's no medicine for coronavirus. We have to remember what's lacking is medical devices, medical equipment, most of which are not exempt from sanctions. The high tech, for example, oxygen masks, decontamination devices, specific suits, as you were talking about, personal protective equipment. I've been in touch with multiple international NGOs who are basically trying to fill the gap of these equipment that don't get into Iran. There's been a lack, and that's caused some fatalities of the health workers, of the nurses that you're talking about. I did some research on that as well. So Iran, as Vera said, has an actually impressive, a pretty good health system compared to most of its neighbors and countries with the same sort of condition. But at the same time, this problem has been beyond the capacity of the health system, and U.S. sanctions are just making it worse. So what I think
I have
U.S.
to add,
officials here in Washington, I'm going to finish real quick. What U.S. officials here in Washington are saying is a little bit misleading to their own public, claiming that medicine is not sanctions, but then also not addressing medical devices and equipment. And of course, the bigger picture of the economic problem that Iran is facing. That's a direct
Nagar,
cause
so you
of the
saying to that,
crippling sanctions.
are you saying to Marija's question, you can't do anything? Is that what you're saying? You can't do anything
No.
as an
I
American?
mean,
What can you
well,
do?
thankfully, we live
Can I?
in a democracy here in the U.S., so they can hold their officials accountable. It could be through members of Congress or the State Department. What I'm just trying to address from a messaging viewpoint is that U.S. officials from the State Department, from the White House, are misleading the public, and this is an important piece of information to have. That it's the medical devices and equipment that they're dealing with, and also the economic problem. However, way the citizens. There are NGOs working on this. There are advocacy groups. There are activists here on the ground in Washington, across the U.S. who are calling on the U.S. government, the Trump administration, to ease sanctions on Iran.
And just
Yes,
can I
Vera.
add to that? So I would say, because I've also lived in the US and I'm quite familiar with the US system and general American attitude. And I think that it's important to really not try to show Iran as this failing state, because Iran was one of the first countries that experienced the outbreak of coronavirus. And the reason why it initially got out of control was because of US sanctions, because we didn't initially manage to get testing kits and personal protective equipment into the country. But then it quickly ramped up production. Civil society mobilization occurred. Sort of the whole society and the strong institutions of the country came together, and they really controlled the pandemic in a way that I wouldn't say it has been outside of the capacity of the health system. So it's really important to acknowledge that, for example, when Joe Biden has recently said that I'm not quite aware whether we need to remove sanctions or not, because it seems like this is a scam and Iran doesn't need help. It's important to say that we don't have to picture and portray a dysfunctional Iran. We don't have to neglect the accomplishments of the health system. We can acknowledge that, but also acknowledge that this is happening under extreme sanction conditions, and the fact that the sanctions have an economic impact, and economic impacts would lead to malnutrition, which then would later cause more coronavirus deaths. So I think it's important to strike this balance.
And Vera, and I have to say, I'm just pushing you just a little bit, because you've written about this, and I'm just looking at the tweet where you're actually saying, this is what I've written about sanctions and sickness, about this nuanced idea of what Iran is able to do in terms of healthcare, and not also necessarily vilify Iran for the way it is governing. What I'm not hearing, and Nagar, I know you did some work on this, is about Iran's nurses. They're martyrs to Trump's maximum pressure. I'm hearing nothing from you about the nurses. In fact, they are now being labeled as martyrs. Tell us about one story that you've been sharing.
So this was a very, very heartbreaking sort of blow to the Iranian health care, well, we call them cadre, but like the group that healthcare providers, basically, that we initially, especially until the peak of the epidemic, we lost about 43, an estimate of 43 healthcare workers, many of them in the northern parts. But it's important to consider that, then again, it's not that my article is neglecting this. It's actually really going to the heart of it, because this happened in the beginning when we didn't have personal.
I was actually bringing in Nagar there, because Nagar was going to tell us some stories about the nurses, but I understand where you were going from. Let me just push on just a little bit as we're talking about nurses. Ali is a nurse. He is in Tehran. He was very uncomfortable about actually speaking to us on camera, so he recorded on video and audio, so we just have his voice. But what his concern was that the official figures were not accurate, and that a number of the medical professionals in Iran were not being allowed to speak about this and being able to explain this.
Unfortunately, most of the hospitals are packed. Nurses are working long hours shifts, sometimes over 12 hours. Sanctions directly affected on healthcare system, and it's the main reason to not having enough equipment and up-to-date facilities. The numbers of death are absolutely fake and far from reality. And from last week again, percentages of visitors with coronavirus symptoms and death because of that increased, which we're guessing we're facing the second waves of spreading the virus. Doctors and nurses have warning and restriction to talk to the media openly about the facts. Some people with heart problem or other health issue histories who died because of the coronavirus on their certificate of the death labeled as heart problem or other health issues. Maybe that's why the numbers of the death of the coronavirus in Iran is far from reality. People are extremely angry because of opening the stores and shops, but they have no options. There is zero support from government and they must feed their family.
So, Abbas, what I want to pick up of this is that you have been diligently reporting the figures, the health figures from the health ministry. I'm just scrolling through day after day after day. You're giving the rundown of the figures, the cases that have recovered, people who have died. How confident are you that these figures that you are sharing are accurate figures? I know it's been difficult around the world to get these accurate figures, but are you confident that this is the full story?
Well, I think, it would be very difficult to give, let's say, exact numbers that how many people in a country have been infected. And that's not an intentional covering up, but that's because you don't know how many. And even those people who have been infected with the virus, they themselves even might not know, and they do not know that they carry the virus because they might not have those symptoms that the others have. That's why you can, let's say, relatively and roughly talk about those figures. But I think there's no reason for Iran to hide those numbers. If you hide the numbers and you, let's say, underestimate that, you would see a crisis in the aftermath because people will not take it serious. And we saw that even when Iranian senior officials, like the head of the legislative branch, was infected by the virus, they announced it to the media. And this is something I think there's no reason for that. And at the time that Iran was giving figures and statistics on daily infection and death toll, some countries were giving 0 cases of coronavirus infection. And we are seeing that those countries who were giving 0 cases, they have thousands of cases. And even some of those countries have surpassed Iran. And I think this indicates that if Iran from early days, they try to give even by details in different provinces how many people were infected. And I think if it was not that much true, it would have been clear very easily in the society. But I think that they have been trying to give those figures. And I think there is a political agenda behind this. When in the West, so-called West, they're talking about covering up those information in Iran, they're just referring to Iran, China, and Russia. So this might
Abbas, I
happen in
have
other
to say
countries
that
as
Ali
well.
is
So
a
I think
nurse.
this is
Abbas,
politicization.
I just want to make sure you're making a broader point here. But Ali, who sent us the comment talking about we can't speak, the numbers aren't accurate, he is a nurse in Tehran. So that is not a Western perspective. That is a nurse who's working in
Can I
Tehran.
add to that?
Go ahead, Vera.
Well, from a Western perspective. And so there are multiple stories like that coming from UK physicians right now as well, that they have been clearly instructed to not record deaths attributing it to COVID. And this has been publicly announced. Whereas oftentimes when we hear these stories from Iran, it's very difficult to verify. And I think and this is not to dispute the personal stories, but it's important that when we talk about Iran, we have to question the assumptions that we are operating on, because oftentimes those assumptions, whether it's a media discourse or an academic one, doesn't really match the facts on the ground, and we really have to look into data. And for example, again, with the case of UK and these and many other countries, there is actual evidence provided by the Office of National Statistics and many physicians publicly announcing that there is a discrepancy. Whereas in the case of Iran, when I have talked to physicians, there hasn't been any limitations for doctors to send swabs. And I worked directly with Imam Khomeini Hospital in Tehran, and there may be a delay in announcing the numbers, but there isn't a discrepancy between the total number. But I also have to add finally that generally we are operating in a chaos of numbers globally. This coronavirus crisis is not an easy one to keep track of. So it's
Vera,
not,
I'm going
it's
to
not to say that.
I'm going to wrap up.
Just
finish your thought, because I have to wrap up.
Numbers. It's as Abbas mentioned. It's just not to say that the numbers provided by Iran are absolutely correct, but it's just to say that this is an issue everywhere, but there isn't any hard verifiable evidence to show deliberate attempts by Iranians to cover up numbers.
I appreciate you making that point.
Well,
I
can I
appreciate
add?
you all being on the show today. We are out of time. So Abbas, thank you for joining us. Nigar, thank you. Appreciate your time. And Vera, thank you as well. Take care, everybody.